are in San Francisco de Macorís in the northeastern part of the República Dominicana, in the Dominican Republic, at the very beginning of a short-term medical mission trip with the University of Central Florida, College of Medicine, and College of Nursing. Much of what we're bringing in are vitamins and medications to treat aches and pains, Tylenol, ibuprofen, things like that, that are very difficult for patients to purchase here.
At the top of the form, put what room number you're in.
During the first 2 days, the students and faculty get organized, and teams of medical, nursing, and Dominican Republic medical students work together in areas of triage, internal medicine, pediatric, cardiology, and gynecology. A senior med student runs the pharmacy alongside more junior students. In a typical day, more than 100 patients can be treated.
A lot of the patients are not receiving care on a regular basis and might have even gone years without care. So we might be seeing a lot of chronic diseases that are presenting late in their course. Another thing we're going to keep an eye out for are any wounds or acute care that will be required here, because the patients don't have the opportunity to be seen very often here.
I think coming from the United States, many of our students never have an opportunity to see rural health care, what we have in the United States versus what other countries don't have. I think it lends a certain perspective as far as caring for patients. I know it's very humbling.
Makeshift exam rooms are made by holding up sheets, and for the first time, electronic records of patient care are kept for future follow-up visits.
You have limited resources. You have to rely more on your clinical skills and medical judgment.
On the third day, a tropical storm brings heavy rain to the rural site of the next clinic and challenging conditions for the team.
So when we first got here in the morning, there was no electricity, which was not that problematic normally, except that it was so dark because of the rain. So at first we had to wait, gosh, for about an hour for the lights to come on. So it's definitely primitive. When you look around, we're in these dark buildings trying to see these patients. It makes things more difficult. For the past 3 days, we've been seeing some diabetes, a lot of hypertension, but it's been interesting.
This community is the most in need that the medical team has seen so far. Despite the poor conditions, they managed to see a large number of patients, but the threat of storms means having to turn some patients away.
I've got a lot more women that we've been able to see today, I think more efficiently than what we've been able to do a little bit in the past, because overall I think it's been a great day. I've actually had the opportunity to do a lot of counseling for sexual abuse too. Given the circumstances of pouring rain, the tarp for cover, and the fact that we've been told that we need to finish off this clinic relatively quickly before the next front comes through, because the river can rise if we get too much rain and then we'd be stuck, we're actually doing great. I think first and foremost I'm an educator, and I love the aha moments in the students' eyes when they get that feeling that they are speaking Spanish, sometimes for very intermediate level speakers, and they're able to communicate with the patient, or they understand how poverty is affecting the people in the community. They'll learn so much by the time they're fourth-year students that they can educate others. It's a very special gift for me that I can get to do these trips.